I was tired, like, it was a lovely day. I enjoyed it. Like, you must send me some photographs of you and Matthew because I don't have any. And people were asking me, and I'm like, well, I don't have any.
Yes, Dr. Manish, we are ready.
Yeah, I can start, sir. Can I start,
You can
sir?
start. Yeah, yes, sir.
Mm. Good evening, good morning, Mr. Mark. I am Dr. Manish. I am the SHO in the clinic. I'll be attending you today. May I
Okay.
confirm your name and identity, please?
Yes, doctor, I'm Mark and I'm 35 years old.
So, Mr. Mark, we are here to discuss about your health condition today.
Yeah.
May I know what is your understanding about your problem, current understanding about your problem, and how did it start?
Yes, doctor, actually, for 2 weeks, I'm having pain in my both legs. It is basically in the thigh area, in upper part of my legs. And it has started like 2 weeks ago, I started my training program actually. So I'm just gaining weight. So I started to have some exercises and I'm doing the cycling also and I joined the gym also. And after joining of this, I'm feeling that every time I'm doing some exercises, after that I have the thigh pain.
Oh, okay, Mr. Mark. Mr. Mark, may I know before we proceed, may I know, do you have any long-term illnesses?
No, doctor, I'm fit and well.
Okay. And so how much duration are you exercising since past 2 weeks?
I just joined the gym, doctor, as I told you, and I started to do it is 1 hour
One,
walking.
1 hour per day. 1 hour per
Yeah.
day. And the after that, are you like hydrating yourself well during that time?
Yeah,
Are
I'm
you
trying to
taking
do.
enough water that time?
Yeah,
Yeah.
yeah, I'm trying to do that.
Okay. Are you taking any supplements for the gym?
No, doctor, I'm not taking any supplements.
May I know your current weight, please? Like current weight?
Yeah, my BMI is 28, doctor. I'm a bit obese. So I joined the gym to reduce my body weight.
Is this BMI increased recently or it has been there for some time?
It is for some time, doctor, gradually, but it is increasing gradually.
Okay. Uh, So the how did this pain, like, is it the same in or is it increasing?
Yeah, it is, doctor. After doing the exercise, after a few hours, I feel my muscles are aching and cramping pain also there with feeling of stiffness of my muscles.
How would you rate your pain on a scale of 1 to 10?
So it is around 5 to 6, doctor.
5 to 6. And how much is the pain after exercise?
No, it is after exercise, it is 5 to 6. And when
And
I'm taking
currently?
it, it's decreasing to 3/10, 4/10.
Three. Okay. And do you feel any difficulty in walking or climbing stairs after that?
Yeah, after the exercise and doing the gym, I feel it is difficult to climb up stairs. And but I can do it. My muscles are okay. I don't feel any weakness, but it is painful movement, doctor.
Okay. And do you have you noticed any change in the urine, any change in the color or the amount of urine?
Yeah, that is another issue, doctor. I told to my GP that I'm noticing now my whatever color is changed to just like a black color, Coca-Cola, Coca-Cola color, doctor.
Oh, okay, okay. Uh, Mr. Mark, I'm sad that you're suffering from this, but I assure you that we'll do our best to help you with this condition.
Thank you,
Uh,
doctor.
okay. So, may I know, is the pain going to any other site also?
No, no, I'm feeling in my thigh area and towards my calf area. These are the two areas mainly.
Okay. Uh, are you currently taking any medications, Mr. Mark?
No, doctor.
No.
Sometime I tried, my GP has given me some painkiller. This is Brufen. It gave me some relief. Otherwise, I'm not on any regular medicines.
Okay. Okay. And do you have do you did you had any injury during the during your gym or anywhere else?
No,
Okay. May I ask you a few personal questions, Mr. Mark? Is that okay with you?
yeah.
Yeah. Do you take alcohol?
Yes, I do, doctor.
How much can you tell me?
It is 5 to 6 units in 1 week time.
Okay. May I ask you to cut down on the same?
Okay, I will consider.
Uh, okay. If you need any help, I'll be referring you to the alcohol physician, doctor. And do you also smoke?
Yeah, I do, doctor.
May I know how many sticks per day?
Yeah, it is 10 cigarettes, doctor, per day. For last
Oh,
15 years, I am smoking.
oh. Mark, I would like to tell you that smoking is like injurious to your health and it will aggravate your current condition also. So I would
Okay,
advise you to stop smoking. And
okay.
also, may I know, Mark, what do you do by profession?
Yes, I'm doctor. Basically, I'm working in a construction company, and I have to I have to climb up the stairs, and
Okay. So
I have to do some
the-
physical work also.
okay. So current problem is affecting your job also.
Yes, doctor.
Okay. And are you taking any party drugs or
No,
no? Okay. May I know, do you have any, like, if it is okay to ask that about, do you have any casual partners?
no.
No. Okay. Is everything okay with your bowel works?
Yes, my body
Yeah.
work is okay.
Okay. And did you travel recently anywhere?
No, doctor.
Have you been through any surgeries in the past?
No,
No. And is there any in the family, anybody has any similar disease?
no, doctor. The best of
No.
my knowledge, no. But my sister is having rheumatoid arthritis and she's on treatment.
Okay, okay, Mr. Mark. Mr. Mark, I would like to know that do you have any before this past 14 days when you joined him, during that time, and do you have any loss of appetite or fever?
No,
No. Did you have any rash?
no,
No. Do you have any racing and pacing of your heart?
no,
Any lumps and bumps anywhere in the body?
no,
Did you notice any throat congestion anywhere?
no, doctor.
No. And can you tell me, Mr. Mark, whether did you notice any change in color of your skin or eyes?
No,
Okay. And are you any herbal medicine or supplements are you taking or any
no,
over-the-counter medicine except Brufen?
no, doctor.
Okay. And uh, may I know any drug allergies? Would you would like to tell us?
No, no.
No. Okay. Are you having is your sleep okay?
Yeah, my sleep is okay, but I'm feeling pain, doctor, when I'm going to bed.
Okay. Okay, Mr. Mark. I understand. We'll help you through it. And
Thank you.
do you have any difficulty in breathing?
No,
No, not difficulty. And uh, even on when you are climbing upstairs or walking
mm,
past, you are not having any difficulty in breathing.
no. Just
Have
like when
you?
I'm doing an exercise, you can say I feel like I'm having some fast breathing and my heart is beating fast. And I think it is related to the my physical activities. Once I'm taking rest, it is coming to normal.
Okay. Have you ever had uh, any time like you know about any abnormal movements of your body? Have you noticed or anybody have you had that in the past?
No, doctor.
No. And mm,
Would you like to examine, doctor? 3 minutes
yeah,
remaining.
I would like to examine. I'd like to know pallor
Okay, general
as
inspection.
general inspection.
Patient.
I would
Yeah.
look for pallor icterus and any clubbing in the hands or any Grotton's papules in the hands.
No.
Uh, no.
General physical examination is looking normal person. Patient
In
looks well.
I would like to examine for muscle tenderness in the calves and the arms is present or not. And I will take the permission of the patient and then examine the muscle tenderness and muscle strength.
Okay. So where you want to examine first, the upper limb or lower limbs?
First lower limb starting from the calves, then going into the thighs after taking permission.
Okay. So what you want to examine in the lower limbs?
In lower limbs,
What will the sequence of examination?
I would take for first I would examine for nutrition, then I would ask for tone, then I would ask for power, and then I would power, and then I would look for reflexes, and
Mhm.
after doing this, if the patient is comfortable, I would look for muscle tenderness, and uh, along with that, yeah, once that is done, I would like to look for a go to abdomen examination, look for a palpable bladder is there or not, and then I would look for hepatomegaly. Once that is done, I
Mhm.
would go to respiratory examination to look for any bilateral basal clefts are there or not, or
Mhm.
any in general physical examination I would also like to look for astraxis is there or not, and
Mhm.
uh,
Okay.
then and
Okay.
jaundice. I would look for jaundice and any chymotic patches are there or not.
Okay.
And
So
I
I
would
will tell you the
at the end I
findings.
would say yes, sir.
I will tell you the findings. General physical examination patient looks well. Hydration status is okay. Okay. Vital signs are temperature is 38 degrees C. Heart rate is 106 beats per minute regular. Good volume. Blood pressure is 100 over 60. Okay. And as you said, the lower limb examination on inspection, there is no swelling or bruises over both thigh and both legs. And on palpation, there is on generally there is the quadriceps muscles and the hamstring muscles are slightly tender to touch and they are firm and slightly warm also. Okay, but the tone and the bulk of the muscles are normal looking. There is no atrophy or hypertrophy. Okay, the power is intact. Okay, but whatever the movement he is doing, it is having some painful movement. Okay, the reflexes and the sensation are normal, and the gait is also normal. But when he's walking, he's just like having some pain over there. Okay, abdominal is examination, no specific findings, and cardiovascular system also is having normal S1 S2 with no added sounds. So now 2 minutes remaining
I
for
would like to address the concerns of the patient. Mr. Mark, do
yeah.
you have any concerns about the your illness or anything would you like to ask about your illness?
Yes, sure, doctor. I'm here for this. Why I am having this pain, doctor, and the
Uh,
changes in the color of my water, why it is going on like this?
Mr. Mark, I feel this is a problem related to your muscle breakdown. And when muscles are breaking down, due to your body was not accustomed to this exertion which you took,
Mhm,
gym, and
mhm,
your muscle is breaking down, which is coming out through your kidneys and going to the urine, which is causing the problem. And you're having the pain because of the same thing. However, we assure you will investigate it and the cause. Meanwhile, I would advise you to stop smoking, stop alcohol, and we'll help you with that. I'll also advise you to stop exercising for a few days, and you can do your routine work. And once your investigations are done, we will start you on a gradual exercise and lifestyle modification program. And uh, uh,
Okay, okay, doctor.
I would,
So this muscle breakdown is affecting to my kidneys.
yes, muscle breakdown is affecting to your kidneys, and that is why you're having this urine problems.
So
Problems.
can it damage to my kidneys permanently?
It can cause damage, but however, I don't know right now without investigations that how much part of your kidneys are damaged or not. It would be more apparent by the investigations. We would like to do some and we'll give you a better picture. However, if it continues the same way, it
Mhm.
can damage your kidneys. But we will assure you that we'll try to prevent it for any further, and you can also follow that you should not exercise for some time and don't do any strenuous work for some time till we treat you.
Okay, does
Is
it
that
mean,
okay?
doctor, that I can never exercise again?
No, no, that does not mean even exercise is beneficial for you. We will start your gradual exercises once we have ascertained your diagnosis and treated you for it.
Okay, thank you. Time is up.
Okay. Thank you, Mr. Mark. Thank you for letting me examining you.
Thank you. Okay, now the examiner's questions. So first is summarize your case.
Sir, I have a case of 35-year-old male who presented with 2 weeks history, a subacute history of bilateral thigh pain, and
Mhm,
uh, and change in color of the urine. On examination, there was he was having pain while walking, as well as there were no signs of there was no fluid overload, and there were no basal palpitations to suggest a fluid overload, and there was no the reflexes were normal, and I would suggest that my diagnosis is rhabdomyolysis, and
mhm,
I would like to rule out the secondary causes of rhabdomyolysis, like
mhm,
underlying myositis. But
mhm.
it looks like this myositis is uh, secondary to the rhabdomyolysis is secondary to unaccustomed word. However, underlying muscle pathology needs to be ruled out.
Okay, so what is your differential diagnosis other than this rhabdomyolysis?
I would like to keep other rhabdomyolysis first. If not, then the secondary I would like to keep is myositis. Or third, I would like to keep is uh, any porphyria, but the patient did not have any recurrent episodes. It's subacute, and the
Mhm.
no abdominal pain was there. So I would keep it very lower down the list of
Okay,
differentials.
any other differentials?
Uh, and
Though not present in this patient, but you can keep in your differentials.
in differentials we can keep as a some we can keep differentials of like hemolysis also, but that
Mhm,
would present with red urine mostly, not with cola colored urine. Other
mhm,
differentials could be sometimes obstructive jaundice. In obstructive jaundice cases also, if the jaundice is very high, the urine can be dark colored, which patient may.
Okay. Okay.
But that is also unlikely in this case.
Okay. Can you give me the differential diagnosis of dark colored urine?
Differential diagnosis of dark colored urine could be firstly the some physiological causes uh, like any consumption of any rhubarb, or secondly it could be due to rhabdomyolysis, or it can be due to the it can be due to the hemolysis, and it can be due to bilirubin pigments, and uh, it
Okay.
it can be due to bile pigments, which can be due to hepatocellular or obstructive jaundice,
Okay.
and there are other pigments which can also cause, like drugs like rifampicin can cause, but they would be more of reddish colored urine, or some
Mm,
uh, food like uh, food like beetroot or blackberries. In rare cases, can cause
yeah.
pigmented urine, dark pigmented urine.
Okay. How you will investigate this patient?
When the patient comes, I would do firstly do a to complete my, like, as an extension of my examination, I would like to do a urine routine where I would look for the blood pigment in the absence of RBCs. I would also look the color of the urine, which would be red, which I expect to be red, and I would do a complete CBC. I would do a kidney function test to look for any whether these rhabdomyolysis has damaged the kidney or not. Once
Okay.
uh, then I would like the damage the kidneys or not. Along with that, I would do a liver function test and electrolytes to see whether there are any changes of hyperkalemia are there or present or not. I would also do
Mm,
a CPK to look for the muscle lysis, and
okay.
uh, along with the after that, I would do for a serum and urine myoglobin. I would look for serum and urine myoglobin, and also I would do a hemolysis screen like retics, LDH, and retic, LDH, and peripheral smear. Once that is done, then I would start for etiological workup. Like I would look for TSH. I would do a toxic screen, and I would do an autoimmune workup also, like uh, ANA antibody and anti-Jovan antibodies to rule out any inflammatory myopathies. Uh, Once
Okay.
and I would also do a coagulation profile like PT, FDT, and INR so as to know any complications of rhabdomyolysis like DIC. Uh, and that's
How you will
and
manage?
one
How you will manage this
regarding
patient?
the by thigh, I would like to do an MRI of thigh to look for any inflammatory myositis. Regarding the management,
We are not doing all the investigations. We have to do stepwise approach. Okay. So it is not necessary to tell all the investigation at one go. So you have to tell the baseline and specific investigations. Then you have to listen to examiner what he is asking for. Okay.
okay, sir.
So
Okay,
the
sir.
next question is how you will manage this patient.
The first I would managing the I would just encourage oral and IV fluids also, and I would monitor the urine output. As this
Mm,
patient was on brufen, I would stop the brufen and ask him to avoid any nephrotoxic drugs like NSAIDs or aminoglycosides. And I would
mm,
target the urine output at around around 500, around 2 liters, more than 2 liters per day. Along with that, if there's any infection, I would treat the infection and give supportive care. I would and I would see any complications of rhabdomyolysis are there or not. I would treat accordingly. If this patient is renal failure, I would see is there any emergent indication of starting hemodialysis or not. And if there's a coagulopathy, I would correct that by giving vitamin K. And
okay.
uh,
Uh,
that's it.
the complication of this problem.
Pardon, sir?
Complications of this rhabdomyolysis.
Complications of rhabdomyolysis could be renal failure, persistent muscle weakness. It could be DIC, and yeah, it could be DIC, sir. And it could be any electrolyte abnormalities can be there, like
Yeah.
hypokalemia, hypocalcemia, hyperphosphatemia, or hyperkalemia.
Okay, then thank you. Just tell me why you want to stop the alcohol in this patient.
So because alcohol also predisposes to rhabdomyolysis. Alcohol is a cause of non-traumatic rhabdomyolysis, so I would like to cut down on alcohol for him to cut down.
You said to him to stop alcohol and you will send him to the alcohol liaison team.
Okay, sir. I should have said cut down on alcohol.
You can ask him to reduce right now, okay? And
Yes.
until we reach to the bottom of this problem. Otherwise, alcohol is not no specific restriction for in this situation right now. Okay, we don't know whether we reach to the stage of electrophoresis or not, but there is myoglobin in this patient. So that is, I will agree with you. Okay, so okay, the second thing is whenever you are asking some personal questions, again you have to ask some some you have to give warnings, or you will have to give some indicator that you are asking some personal questions, like directly ask about the party drugs. So I would like to ask you some personal question or private questions. So I hope you will not mind it like this. You can say something and then you can ask it. Okay. And
Okay.
you can directly ask about do you have some casual partners? This is also not a good question directly. Okay. So you can ask first, whom do you live with? Okay. So whom do you live with? And then if, you will say whatever the is marital status, whether he is married or unmarried. Okay. So he can tell you I'm living with my wife. He can tell I'm living with my partner. So whatever it is. Okay. Then you can ask the second question. May I ask you some personal question? Do you have any casual partner? So directly, do not ask directly that you have some casual partner. Are you living with casual partners? So whom do you live with is the first question. Then you have to proceed from there. Okay.
Okay.
And then in the history questions, you have to ask organize history. Neuros deficiency in the thigh. He's having two.
Sir, your voice is low, sir. Can you?
Sorry.
Yes, sir. Your voice was not audible, sir.
Okay, sorry.
Yes.
Is it better now?
Yes, sir. Yes, it's better, sir.
Okay. So about the history also, you have to focus on the presenting complaints of the patient. Then you have to ask the all the question related to the presenting complaint and that area of presenting complaint. Then you have to proceed to other part of the body. Okay. For example, in this patient, there is a complaining pain in both the legs. Okay. So which part of the body, which part of the legs you are having the pain? How it started, suddenly or gradually? Okay. And then is it radiating to anywhere? What is the character of this pain? Any aggravating factor, any relieving factor? Okay, so these are the questions that we have to ask. Then, do you feel any weakness in your legs that you did not ask? Okay, so then any weakness in your foot area or in your ankle area or your foot area especially. These are the questions that you can ask about the thigh pain. Then any numbness or tingling sensation is there or no? Do you feel that when you wake up in the morning, do you feel that your your legs are weak? Okay, so this is another condition that we are trying to rule out, like thyrotoxic periodic paralysis. Okay, and are you taking some specific food, and did you notice with this specific food to have any weakness in your legs or no? Okay, then do you have any weakness while you are climbing upstairs? Do you have any weakness while you are standing from sitting position, from a chair, from the commode, from the car seat? Okay, do you have any weakness while you're combing your hairs? So from the legs, now you are moving to the proximal myopathy or myositis of the upper limbs. Okay, do you have any difficulty while you are doing shampooing your hairs? Do you have any difficulty while you are brushing your teeth? So these are the questions that you have to ask. Okay, and then the second question, the second presenting complaint is color of the urine that is changed to dark color. Okay, so what time of the day do you notice that your water work is dark in color? Did you notice that when you are passing the water work, it is dark at the start, or uh, while you are passing, it is like a yellowish color, and then while it's standing, it is changing to dark color? This is another question. Okay. Then do you have any difficulty in passing the water work? Do you have any pain while you are passing the water work? Do you have any gravels or the stone did you pass in your water? Okay. Do you have any burning sensation? Do you have sometime did you have any retention or obstruction of your water work? So these are the questions related to the water work. So complete question you have to ask about that. Did you notice any time the reddish colored or fresh blood in the water work? So visible blood in your water work. So these are the questions that we have to ask. Clear?
Yes, yes.
Then your differential diagnosis, then you have to ask a certain question related to your differential diagnosis. Like you are thinking about the porphyria. So do you have any tummy pain? Do you have any this tummy pain coming and going? And if the tummy pain is there, what part of your tummy you are having the pain? Okay, and what about your bowel habits? Are they regular or no? Do you have any hard stool or loose motion? So these are the questions that you have to ask. Then you have to ask any changes in the color of your poo. Okay. Did you notice any black colored stool or no? Okay. And did you pass any time blood mixed with your stool or no? So these are the questions that you have to ask. What about your appetite? And do you feel any sickness? Do you have any thrown up or no? So these are the questions related to the GIT. Then if you're thinking about some rheumatological condition or autoimmune condition, then you have to ask, do you have any joint pain? So muscle pain he presented, then the joint pain. Do you have any pain in your hip area, in your knee area, in your ankle area, in your foot area? What about your fingers and digit of your feet? Do you have any pain over there? Did you notice any rashes in your body? So these are the questions. Then while these symptoms started at that time, were you having any high grade temperature? Were you having any flu-like illness? So you are ruling out viral cause of myositis. Okay. So these are
Okay.
all important questions that we have to ask. Okay. Then
Yes.
systemically, you did write that you started, then after the starting, you asked me, do you have any long-standing disease? That is valid question. I will agree with you. But once you have asked the past medical history or the past surgical history, then you should focus on the presenting complaint. Then you have to try to ask all the questions related to that system or that area, then related to other areas. Okay. So like this, you have to complete your history. Then go to the past medical history. If you did not ask before, do you have any long-standing disease that I should be aware of? Okay. Then any past surgical history. Then do you take any medicine in this period of time? So your GP advised you some medicine or no? So this patient was taking brufen. How frequently you are taking the brufen? Okay. And uh, then you will proceed from there. And then you will ask about, do you have any allergies with any food or any medicine? So these are the questions. Then similar condition in the family or any long-standing disease in the family. If yes, then ask the further question. Then the personal history, you should start with the, like, do you smoke? Yes, so all the patients who are a smoker, we have to inform them that you have to stop smoking because smoking is injurious to your health. So like this, then the alcohol, then the job and the effect on the job, and then the driving also we have to ask, and then whom do you live with, and the further questions. Any travel history, any dietary changes did you notice, did you do in the recent past or no? The dietary history is also important in this patient. Are you taking any specific type of food these days, like the beetroots or some special beans or something like this? Are you taking some high protein diets or no? So are you taking any supplements as you are going to the gym? Okay, so these are the questions. And at the start, you should ask this patient how much active you were before these 2 weeks time. Did you start your activities of this gym suddenly, or if you started suddenly, was it aggressive? You are doing the aggressive workout or no? So looks like he's doing the aggressive workout of 1 hour, and after that he's getting this thigh pain. I hope it's clear.
Yes, sir.
Okay, so these are the questions and important points. Then here we have to go to the differential diagnosis. So the differential diagnosis is most likely here the rhabdomyolysis. And then the second differential should be the McArdle's disease, glycogen storage disease. That should be the second differential. Then other differential could be the metabolic myopathies. Deficiencies of certain enzymes can lead to this condition. Then another one is infectious causes, like after the viral infection, influenza or the Coxsackie virus, patient can have viral myositis. Then the patient can have idiopathic recurrent exertional rhabdomyolysis. So we have to ask this episode is first time you are having, or the previous time also you are having such episode. Okay, so these are the initial differential. Then the further differential you can include here hemoglobin urea causes. Okay, myoglobin causes, hemoglobin urea causes. These are the two top of the differentials here. Okay, so after that, we can include further differential like concentrated urine, and dehydration can also produce the dark colored urine, dark or amber colored or light brown colored urine. But this one is the dark black color or just like a cola color urine. Okay, then the other possibilities are bilirubinuria can also produce such type of pigmentation, not like this, but dark yellow or the brownish. Okay, then we have the urate in the urine or hyperuricosuriia can also produce, and certain foods and drugs like the beetroots, fava beans, and food coloring agents, and the drugs like metronidazole, nitrofurantoin, senalaxative, and levodopa. So these are the drugs that can cause, and the differential diagnosis will also include the porphyria. Okay, so these are the differential in this patient.
Okay, sir.
Then we have, yeah, then we have to proceed for the investigation. So investigation panel, I used to tell to my candidates that you have to divide your investigation into the baseline investigation and the specific investigation, and do not give the complete whole list of the investigation, because they want to check how specific you are, how baseline investigation, whatever the investigation you are doing, there should be some reason behind it. The baseline investigation should be like, you will do the full blood counts, urea and electrolytes, monitor the kidney functions, whether the patient is having acute kidney injury or no. Creatinine I want to see, and the potassium. These are the two important points that we have to see. Other than this, the inflammatory markers, ESR and CRP, and the liver function test. Then the muscle enzymes are important. Creatinine kinase will be highly increased in this patient. Okay, and then the urine analysis that will be positive for blood on dipstick, but microscopy will not show you the RBCs. No RBCs on the microscope. Then the specific investigation you have to think about, muscle biopsy and genetic testing. Muscle biopsy will show you, histology will show you the subsarcolemmal glycogen deposit if it is McArdle's disease. Okay, and then the genetic testing if we are suspecting about McArdle's disease. But per se, if the patient is having exertional rhabdomyolysis, then these tests are not needed. So these are the investigation that we have to focus. Then other investigation, if you have the differential diagnosis of autoimmune work, then you can include the ANA, anti-DNA, anti-Smith antibody. And the polymyositis and dermatomyositis you can include in your differential diagnosis here, but that will be having the more muscle weakness than the pain. And there could be the joint involvement also, and there could be the rashes also, that heliotrope rash and the other type of rashes that is present in dermatomyositis. I hope it's clear.
Yes, sir.
Doctor, you can repeat it, the differential diagnosis, please.
Yeah, sure. So the
Thank-
differential diagnosis here, you can divide the differential diagnosis of muscular pain leading to acute kidney injury, and the differential diagnosis you can include to the dark colored urine. Okay, so these are the two type of differential diagnosis. So here I will first give you the differential diagnosis about the thigh muscle pain and leading to decreased renal output. So it will be like the exertional rhabdomyolysis in this patient most likely. Why it is like this? Because the patient is doing the strenuous exercise that is causing direct damage to the muscle cell, leading to release of the myoglobin. Okay, that is going to the bloodstream and going to the kidney, causing the acute kidney injury. Okay, so exertional rhabdomyolysis is the top of the differential here, and the second one is glycogen storage disease, and the third one is metabolic myopathies, other metabolic myopathies, and the fourth one is infectious causes of viral myositis. Then the idiopathic recurrent exertional rhabdomyolysis can be included. Then the polymyositis, dermatomyositis can be included. Then the muscular injury can be included, but you have to take the history. Do you have any trauma? And uh, Dr. Manesh rightly asked about the injury. Also, sometimes the intramuscular injection can also present like this, but in that condition, the pain will be localized. Pain will be localized. And in muscular injury, like if the patient is having someone who is having severe muscular injury, road traffic accident or something like this, in that condition, the patient can go into rhabdomyolysis. So these are the differential diagnosis for muscular injury leading to the kidney presentation of dark color urine. Then the dark urine differential diagnosis. So the differential diagnosis of dark color urine can be because of the rhabdomyolysis or the myoglobinuria, hemoglobinuria, kidney condition like glomerulonephritis, liver condition like the patient is having cirrhosis or the patient is having hepatitis and the patient is having bilirubinuria. And then the certain foods like the beetroots, fava beans, and then the dehydration by itself can produce the dark colored urine. Then certain vasculitis can cause and certain medicine can cause like chloroquine, primaquine, metronidazole, levodopa. So these all can be included in the differentials, and you have to decide what type of differential you want to give and how you are presenting your differential diagnosis. Then from there, you will go to the investigation panel as we discussed, the baseline investigation and the specific investigations. Then you have to manage, you have to go to the management of this patient. So first try to make the your multidisciplinary team. Okay, so here, who will be involved? Your GP will be on board. Okay, then the nephrologist should be there, and the physician should be there. Metabolic physician can also be included. Okay, then the dietitian should be on board. Okay, and then the further you can include like in the long term run, as we have to inform the patient that you do not have to do the aggressive workout. So we will involve the occupational therapist and physiotherapist also here. So this is our multidisciplinary team. Then I will go to the management of this patient. So non-pharmacological management and pharmacological management. The lifestyle modification here is key. We have to inform him that you have to avoid the sudden, intense burst of exercises. Don't do like this, but I will encourage you to do the regular low intensity aerobic exercises that you have to increase gradually. Okay. So, and when you are going to start your activities, first you have to warm up your body. Warm up is very important. And together with this, whenever you are doing any workout, you have to maintain your fluid intake uh, very adequate. Okay, adequate intake of the fluid, and also the diet should be balanced. Okay, so these are all important points, and you have to take care of the weather, what type of weather you are doing the exercises and workout. So if it is like very hot weather and if you're doing excessive workout and you are having excessive sweating, then you are prone to develop this rhabdomyolysis or myoglobinuria. The medical treatment, there is no specific treatment, but what we have to do, we have to hydrate the patient very well. Okay, and once the patient is developing like acute rhabdomyolysis, we have to admit the patient. So disposal of the patient is also very important here. We have to inform the patient that after doing the initial investigation, I will tell you what we have to do for you. Might be you need the admission. If you have your salt level in your body is dangerously or significantly affected, we will admit you. And the second thing is if your kidney functions are affected, then again, we have to admit you. So if you are going to admit this patient, you have to give the IV fluid. That will be the mainstay of treatment in the patient with acute rhabdomyolysis. Okay, so this is all about this case and what could be the complication of this disease. So this can lead to myoglobinuria and rhabdomyolysis can lead to acute kidney injury. Okay, and then the electrolyte imbalances, especially the hyperkalemia that can lead to cardiac arrhythmias, which also we have to remember. And DIC is one of the rarest complication or the progressively, if the problem is increasing, patient can go into DIC. But another important complication is compartmental syndrome because the patient presented with muscular pain. So this is all about this case. Now we will move towards the communication scenario. For this, I will ask someone volunteer if someone is interested to perform. So I will welcome that doctor. Yes, Dr. John, you can take the case.
Yes, sir.
So
Am I
this
audible,
was,
sir?
yes, you are audible.
Okay.
So just to finish the first case, this was the case recently came 2 days ago in Muscat, Umar.
So,
And
alkalization of
yeah.
urine is a part of the management now, sir?
Can be part of the management according to the lab findings. Yes, VBG can be included in the initial investigation. If the patient is having like acidosis, then we have to see how much acidosis if the patient is having. If it is less than 7.1, it is significant. If it is less than 7, yes, then we have to correct with the sodium bicarb. Less than 7.1 is, it means the red flags is started. Above 7.1, we can hydrate the patient well and may not need the alkalinization by the sodium bicarbonate. Clear?
Okay, sir. Okay, sir. Thank you.
Thank you.
Sir, can you grade on that those criterias? Empath and like
Which criteria?
the examiner evaluation criterias, like clinical knowledge,
Okay. I will.
examination skill. Yeah.
Okay. Yeah. I will do it. I will do it after this scenario.
Okay, sir.
Okay.
Yes.
Yes, Dr. Jim.
Yes, sir. Just preparing, sir. 2 minutes.
Yeah, you have to take time like 5 minutes. Okay, this is
Okay.
slightly a lengthy scenario. So, like an exam, you have to prepare in 5 minutes. So I will give you 5 minutes.
Okay, sir.
This scenario also came 2 days ago.
Can I start, sir? Hello, sir. Am I audible?
Sorry, Dr. Jim. Yes, I was online actually. So we'll start in 1 minute time. Give me 1 minute more, please.
Okay, sure, sir.
Thank you. Yes, you can start now.
Yes, sir. Good evening. My name is Dr. Jim John. I'm the SHO in cardiac OPD.
Yes, doctor.
Can I confirm your name?
Yes, I'm Mr. John, doctor, and I'm 55 years old.
Okay, thank you. I'm here to discuss your health condition today.
Yeah.
May I know, before we proceed, may I know what do you know about your health condition?
Yes, doctor. Actually, I had the heart attack 1 month ago, and I was admitted in your ward. Before that, I am known case of high blood sugar. When I was admitted in your ward with the heart attack, you people have done some procedure and you put some stent into my blood channel of my heart. And this was the treatment that I received from your hospital. And then I was discharged after 2 days, and you people told me that everything is fine. And you people told me to be followed up to the GP clinic first, and then and then you have the OPD follow-up in your OPD, in cardiac OPD also. But I'm sorry to
Yeah.
tell you, doctor, I'm having some concern. I think the GP is a better doctor than you people are. Recently, in last 2 weeks' time, I noticed that I'm having difficulty in breathing. And this difficulty in breathing was coming when I'm doing some exertion. So I was worried that what is going on with me. So I went to my GP and he did some blood test for me, and he told me that your hemoglobin level is low. And he was telling me that my hemoglobin level was also low when I was admitted in your hospital also. So
Yeah.
I want to know, doctors, how you people did not address this issue.
Yes. Thank you for telling me that. That I really appreciate your knowledge about your health condition. I would again, I apologize for what you are going through. It must be really frustrating. Again, first of all, you had a heart attack. So let me explain what has happened to you from our side. So you had, right, as you rightly said, you were admitted with us with a heart attack 2 weeks back, and we diagnosed that. We found out the heart attack, and we put a uh, device into your blood channel to restore the blood flow to your heart.
Yeah,
And
yeah,
that time, actually, we had done the blood levels, and the value had shown as 11 gram that time. And at the time
yeah,
of discharge, it was nearly 9. After
Mhm.
this, putting this device into this blood channel, we, as per the protocol, you were given this blood thinning medications in order to prevent further clotting into the device and prevent further heart attacks. To reduce the chances of further heart attacks, you were given the medications as well.
Okay.
Since after discharge, you've complained of shortness of breath, and for this past worsening, that is worsening since past 2 weeks, and the XP, the blood levels when the GP had checked, it is has dropped from what it was from that 11 to 9, and then now it is 7. I
Doctor,
really
that's
understand.
okay. That's okay. That's okay, doctor. Dr. Tim, I will interrupt you like in the exam they are doing. So don't worry about that. Huh? So I want
Yes.
to ask, doctor. So when I was admitted, my hemoglobin level was 11. It was low at that time also. You people did not address it. How did you ignore that? And when I was discharged, it was 9 gram. So again, it is not the level that should be a healthy person should have. So my question is how you ignored these levels and why you did not discuss with me these issues.
That is definitely a valid concern. I can only apologize for what has happened. But definitely, I wanted to explain that since you had presented with a heart attack, which is a critical condition that time, we had
Yeah,
done an urgent procedure to improve the
yeah,
blood
I know
CP.
that you did the procedure, doctor, and that is the good job that you people have done. I'm thankful for that. But my question is why you ignored this thing? How you
Yes,
ignored?
Uh, when we found this small drop in your blood levels,
Yeah,
we actually there is a plan of uh, doing a camera test, putting a tube to your mouth and your back passage to
nobody
look for
discussed.
possible.
Nobody discussed this plan to me, doctor.
Definitely, that is error from our side, and I sincerely apologize for what had happened.
I want to complain
Uh,
for that, doctor. How I can complain?
Definitely, I can arrange. I'll help you guide to the patient advisory and license services for you to do that. And definitely for right now, since your blood levels has significantly dropped, it is your health well-being is of utmost importance. And I would like to admit you right now, and
Thank
probably
you, doctor. Now my second question is why my hemoglobin is dropping, doctor?
yes.
Is it
So
because of
again.
the blood thinning medicine that you people are giving?
It is definitely possible that it is causing any internal bleeding. We have to consider that, and we'll have to admit you and give you blood transfusion, blood through your blood channels to increase your blood levels so that you're stable enough to undergo the procedure of a camera testing. And I'll urgently involve the gut doctor as well to do the procedure for your betterment. And
Okay. What could be the other possible causes, doctor, for me to drop the hemoglobin? Do you think this is the only the medicine that you people are giving is the
uh,
cause, or any other cause could be there?
For this sudden drop from 11 to 7 over this period, since you were given this blood thinner medication, that would be the most probable cause. There could be other contributory causes as well, because you said you have having diabetes, and as per our records, you are a smoker. So there are possibilities of abnormalities within your gut, and
Do you think, doctor, could I have some tumor in my gut?
it is possible, because with your considering your smoking history, and there is a possibility and needs evaluation. And since you had presented to us with a heart attack at that time, the treating a heart attack was more priority for your best interest.
Okay, so what you are going to do for me now, doctor?
So I'll admit you, and I'll arrange a blood transfusion for you to bring your blood levels up. I'll involve the gut doctors and consider for an early, very urgent camera test to look into your gut through a camera test, both through your mouth and the back passage, and we'll find out the source of why the blood levels has been dropping. And I would like to again ask few more things if that's okay with you.
Yeah, sure.
May I know what do you do for living, Mr. John?
Yes, doctor, I am a school teacher.
Okay. Do you drive?
Yes, I do drive.
Okay. I would just wanted to reinforce that since you've underwent since you had a heart attack and you had a device into your blood channel,
Yes.
you need to and right now since you're having this hemoglobin drop, since the issues are sorted out, I'd ask you to refrain you from driving.
Okay, doctor, I would ask some further question, Dr. Jim. Would you please tell me why I'm having this difficulty in breathing? Is it because of another heart attack?
That is very unlikely because the drop in blood levels can cause the oxygen to reach the tissues, and that can actually cause this breathlessness, and that is what is probably causing the breathlessness in you, Mr. John.
Okay, so you told me, doctor, you are going to give me the blood transfusion. Really, I'm worried about the blood transfusion. I'm worried about the side effects of the blood transfusion. Could you please tell me what could be the possible side effect of the blood transfusion?
I totally understand that it could be frustrating for you. Where the possible there are rare side effects that can go wrong with the blood transfusion. There could be some allergy. There could be some the body could actually reject since it is another person. It is blood that is given from outside. So there could be few reactions from your body which actually can be managed, and even the fluid levels in your body, it can go up with this transfusion. So we'll give you medicines
I'm
to pass
concerned
more
about
urine.
mainly, doctor. I'm worried about the HIV and hepatitis. Is it possible to be transmitted by the blood?
Definitely will be the blood that is being transfused to you, it will be screened for that, and it is extremely unlikely for you to contract such an infection.
And doctor, as I'm having the heart attack, is it safe to receive the transfusion for me? Will it not cause any effect on my heart?
Definitely, it will actually help you your heart to function better, because when there is a low blood level, there is more strain on your heart, and with the blood transfusion, that will actually help your heart to function better. The strain will be lesser.
Okay, 1 minute more
And
if you want to do something more, because I tried
are
to
there
give you all the concerns. So 1 minute,
yeah,
1 minute for
uh,
you to do something more if you want.
yeah, so I would like to summarize for what about this discussion again. So
And
you
other than
had a
this,
heart. Uh, can you tell me what have you understood from this discussion, Mrs. John?
yeah, so in such scenarios, I will not give you suggestion to involve the patient, because he will start and will start fighting again with you.
Okay,
So
all
you
right.
have to summarize. You have to summarize.
Okay.
You have to give him the brochures and the leaflets. Okay, and if you want to ask about the personal history, and if you want to give him some leave, because he will be admitted again in the hospital. He's
Yeah,
already
smoking
in the
cessation also, sir. Smoking
yeah
cessation
yeah
should mention, yes.
yeah. So smoking cessation, alcohol, job, and driving, that must have been already informed him while he was discharged from the hospital. So you can
Yes,
again ask, and you can highlight that. And
yes,
together
sir.
with
Yes.
this, you can include like the brochures and the leaflet about the low hemoglobin count, further workup, like you can give him the camera test, endoscopy, brochures and the leaflets, okay? And then you
Yes,
can
sir.
give some the information about the blood transfusion, as he's having concern about that.
Yes, sir. Yes.
Okay, so that is how you have to complete your scenario.
All right, sir. Yeah.
Thank you. So is it a mistake
Thank
scenario or no?
Sorry, sir.
Is it a mistake scenario or no?
It is not a mistake as such, sir, because it is emergency that time, and for the best interest, it is done. The communication should have been that part will be a mistake, sir. The patient should have been informed about the hemoglobin uh, at the time of discharge, and the further workup should have been planned at time of discharge.
So it is a mistake scenario.
Yes, sir.
Yeah, it's a mistake scenario. And the patient
Yes,
was
sir.
admitted with acute coronary syndrome and his hemoglobin was low. Okay, the normal hemoglobin is 13, 14 for the male patient, for the male people.
Yes, sir. Yes, sir.
He was
Yes, sir.
having low hemoglobin at the beginning also. It was 11, okay? Then it was
Yes, yes.
dropped to 9 while he was in the hospital. Okay, then
Yes,
it
sir.
is dropping further. So what could be the possible causes of his anemia?
He could be having a probable peptic ulcer disease, which has been bleeding and then would have worsened with the blood thinners, or a gastrointestinal malignancy again.
No, no, my question again, are you appreciating that this patient was having previously also anemia?
Yes, yes.
Okay, so
That is
you
a
have
peptic
to,
ulcer or a gastrointestinal malignancy, sir. That is
yeah,
smoking
so
is.
you have to start from there. If you are again doing this scenario somewhere in the exam or while you are doing the practice, you have to start from there that you were having the low blood count, and what could be the possible causes before this double antiplatelet agents and other than this PCI. So you have to focus on that also first. Okay, so you
Yes,
have
yes, sir. Yes.
so he will be blaming to the double antiplatelet agents, but you have to inform him that you might be having this anemia or the low blood count because of some long-standing disease. One
Yes, sir.
cause.
Yes, sir.
Okay.
Yes,
The
sir.
second possibility might be your body is not producing enough amount of blood, that we have to see why you are having the low blood count from the start. Okay. Then
Yes, sir.
might be
Yes,
you
sir.
are losing your blood somewhere from your gut or from your bowel or from your the water work. Okay. So I have to
Yes,
take your history in detail and I have to examine you and I have to try to find out the first why you were having the low blood count while you admitted with us. This is the first thing that you have to highlight.
yes,
And there are
yes, sir.
different causes for that. We have to proceed and we have to do the investigation on you. So this is the
Yes, sir.
first point that you have to inform him. Then he will ask you, then you can inform him that the PCI related sometime after the PCI patient can have some uh, drop in hemoglobin that is acceptable and that is you can say the expected
Yeah.
drop, but it is
Yes,
like a
sir.
rare type of blood loss. And
Yes,
at
sir.
that time when you were discharged from the hospital, it was really a mistake from our side. I'm sorry for that and I apologize from my side and from my whole team. Okay,
Yes, sir. Yes,
so
sir.
what you have to say this is our mistake and I apologize from my side and from my whole team. So we
Yes, sir.
will write the incident report. I will inform to the consultant. I will inform to the nursing manager, and we will write the incident report. This should not
Yes, sir.
be happen. This should not have been happened to you to any other patient. Okay, I
Yes, sir.
really sorry for this, and I apologize from my side and from my whole team. So
Yes,
this
sir.
is the mistake scenario. So then you have to inform the actions, what actions you are taking. You are writing the OVR. You are informing to the consultant. You are informing to the manager of the house of the ward or the nursing manager. Then you have to inform him that the root cause analysis team will find out why it happened and how it happened. Normally, it is not our hospital practice. We used to follow the high standard in our hospital. Okay.
Yes, sir.
The root
Yeah.
cause analysis team will analyze why it happened and why we missed this. And really, it is just like a breach in the system. Okay, so who is responsible? We all are responsible for this. It is just like when you came, it was right. It was right that you were in an emergency condition. At that time, we have to address and we rightly address your serious problem, and we did the stenting, and we restored the circulation. Okay, so that
Yes,
was a
sir.
good job.
Yes, sir.
But having said that, I'm not escaping or ignoring this right now. I don't know how it was ignored, and it was a serious mistake, and I apologize for this. So just like you have to inform, and you have to inform the
Yes,
root
sir.
cause analysis and everything, what steps you are going to take, and you have to reassure him that I can guarantee you that it should not happen to anyone, to you, or to anyone in the future, because the root
Yes,
cause
sir.
analysis team will do the investigation. They will find out why it happened and how it happened, and we will fix it, and they will give the recommendation. We will follow those recommendations so it will not happen again. So this chapter is
Okay.
closed.
Okay.
Okay. He
Okay, sir.
wants to complain, then you have to inform him that I will guide you. There is the patient advisory and the liaison services in our hospital. I will guide you. You can launch your complaint, but I reassure you that our services will not be affected. We will continue to provide you high quality services. Okay.
Yes, sir.
Despite of
Yes,
your
sir.
complaint, this is your right, Mr. John. Okay, clear?
Yes, yes, yeah.
Then you will go back and you will inform him that, okay, now we have something significant that we have to discuss that is quite concerning to me that, Mr. John, I want to discuss with you now. Would you please give me chance to highlight these points? So he will give you chance. Okay. So then you will inform the patient that actually we are concerned now that we want to find out where you are losing the blood. Okay. And why you are losing the blood. So the previously what I mentioned, the previous causes that we already discussed. The possible causes now, he will raise the issue of this double antiplatelet agents. Yes, this could be the contributing factor, but this is not the reason actually, Mr. John. So you might be having some bleeding ulcer in your stomach area, might be you having some swelling in your stomach area, you might be having some other issues in your gut area. So we have to do some urgent investigation on you to find out the cause. Okay. And why you gave me, doctor, these two antiplatelet agent? This is for your benefit according to the national and international guideline, Mr. John. It is highly recommended. This is recommended to maintain your circulation and to avoid you to have a new heart attack in the future. This is important thing. And the third important point is we have placed this small stent, we say stent, and it is just like a, you can say the channel that we put inside your blood channel of the heart to restore the circulation. This is very important to give you two antiplatelet or the blood thinner medicine to keep this precious material patent. Okay, something like this you have to explain to him. Clear?
Yes, sir.
So
Yes, sir.
this could be the contributing factor, but this is not the cause, Mr. John. I can reassure you. Okay. So what you will do
Yes, sir.
now for me, doctor? So not only the camera test, but you have to say that we have to run the full blood count for you. We have to do the iron studies. I have to check your kidney functions. I have to check your other test also. I have to send you a stool for to find out whether you are having some blood loss from there. The stool test is known as occult blood test or the FIT test. Now the new test is a FIT test they're doing. Okay. And from there we
Yes,
have
sir.
to do some urine test also to find out whether you are having some blood loss in your water work or no. Okay. And after that, if we could not find out the reason of any low hemoglobin count in these tests, then we have to do some specific test for you that will include the camera test. For that, we will involve the gut doctor, and initial stage, we will do the camera test. This is the possible thing. I cannot guarantee you, Mr. John. This could be the possible stepwise approach in your case. Okay, the camera
Okay, sir.
test.
Yes,
Okay, so we have to do the camera test. So first we will do the camera test from the from your food pipe, from your mouth to the food pipe to the stomach area to find out whether if you have any bleeding from the stomach area or from the upper part of your gut. Okay, if it is negative, then we have to proceed further. We may do another camera test from your back passage. So this all will depend on the stepwise approach in your investigation. But I can tell you, Mr. John, these all are very important tests that we have to do. And before going for the test, and after doing the baseline investigation, very important to maintain your blood count, and we need to give you some blood. So he will ask you, doctor, is it safe for me to get the blood transfusion because I'm having the heart attack? So you have to reassure him that, Mr. John, it is actually very important because you're having the difficulty in breathing while you're doing some exertion. So it means your blood count is significantly low, that is causing strain on your heart because of the low blood count. Clear?
yes, sir.
Then you have to proceed from there, and then you have to address his concern about the risk and benefit of the blood transfusion. So main benefit, it will quickly relieve your symptom, Mr. John. The shortness of breath will disappear and you will not feel any tiredness. Okay. And
Yes, yes.
your blood pressure will be on a safer side, your heart rate will be on a safer side. So this is very highly recommended to have the blood transfusion. Then he will
Yes,
ask
sir.
you about the side effects of the, yes, the blood transfusion could be having some side effects. So most common side effect is just like you may develop like slight fever or the chills, or might be some rashes, But don't worry, we will keep you under observation while we are giving you the blood transfusion. Okay.
Yes.
Then there are some serious side effects. You are concerning about the hepatitis and the HIV. I can reassure you now with the recent techniques and the modern test is what we are doing before the blood transfusion. We are arranging the blood that is pure and that is free of the any infection. So the chances of having the infection is negligible, Mr. John. Okay, it is
Yes,
less
sir.
than
Yes.
one in 1 million. Okay,
Yes, sir.
but I can tell you further thing is just like a fluid overload you might have because you are having just now the heart attack. So what we have to do, we have to give you the blood transfusion very slowly, and we will do the blood transfusion under close monitoring. So it will be safe
Yes.
for you to have the blood transfusion. So we have to reassure
Okay.
him about the blood transfusion also.
Okay,
So
sir.
this is all about this case.
Yes, sir.
Okay,
Sure,
so
sir. Thank you, sir.
everything in this, you're welcome. So in this type of scenario, we have to be very fast nowadays. Nowadays, the scenarios of communications are just like a bombardment of the scenarios and the concerns. Okay, one concern
Yes,
is
sir.
not finishing, and the patient or the surrogate is giving you the next concern immediately.
Yes,
Okay,
sir. Yes, sir.
if they are giving you the same concern 2 times, it means you did not address the previous concern rightly. He is giving you another chance.
Mhm. Okay, sir.
Okay, he will repeat only 2 times, and if you are repeating
Okay,
the
sir.
same answer, if you are repeating the same answer, it means you are losing the marks. Clear?
Okay, sir. Yes, sir. Yes.
Okay, so I will see the chat now, what we have to see in the chat now. Okay, so my WhatsApp group, doctors, I will write now the number. You send me the message on my WhatsApp. I will send you the link of my group of this is my number 966 593737 Just whoever wants to join my group, please send me a message. I will send you the link. Okay. Then what is the next? Okay, can you please share? Okay, mistake is that we did not conceal. Yeah, this is the mistake scenario. We did not inform him, Dr. Manish, that when he was admitted while it was the acute emergency, acute coronary syndrome. It was an emergency. After managing the emergency, we have to inform each and everything to the patient. Okay, Dr. Manish. So this is your answer. Root cause analysis team. Yes, we'll do the investigation. Root cause analysis team is just like an investigation team, and it's a separate team that what we have to do, we have to do the incident report, and incident report will be going to the specific office, and they will assign the team. That team will start from the zero. When the patient was admitted, what was the situation and what happened and how it happened. They will find out and they will do the investigation. They will try to find out the reason. Where was the breach? So mainly they will try to uh, uh, overcome this breach or the problem wherever it is. Okay. So in the simple words. Okay. So what is the error? Error is we did not inform about the hemoglobin drop in this patient. Okay. This was the error. This was the mistake. It is the mistake scenario. What about the antiplatelet during the endoscopy and colonoscopy? We have to see whether you are going to do the biopsy or no. If you're going to the biopsy, then we have to stop the antiplatelet agents like the aspirin. We have to stop like 7 days before the procedure. But again, this will be discussed and decided by the multidisciplinary team. You can say like this, it will be decided by the multidisciplinary team. Okay, so and it will be discussed by the gastroenterologist what he is going to do, what he is expecting to do. So if he is going to do the biopsy, so if it is a small biopsy, then it is of no seriousness. We can keep the patient under monitor. Because if you are stopping the antiplatelet, then the stent thrombosis and stent uh, clottage or the stent obstruction is the risk. That is also very serious thing. So we have to see the risk and benefit, and the team will decide. Multidisciplinary team will decide. Do we need to also consult the cardiologist? Yes, the patient is there in the cardiology OPD, so you have to inform to your consultant. And the dual antiplatelet, we have to try to continue dual antiplatelet uh, in in as much possible things we have to continue. Okay, we should not stop this. Do we need to ask the briefly history about? Yes, you can ask some brief questions, or you can ask indirectly. Some people, they lost the blood in their gut and they have got like a black stool and they are not noticing it. So if yes, like this, so he will tell you, yes, I'm having the black stools. So indirect way of question you can ask. Some people they are having like so if, when he is asking you what could be the possible causes of low blood count when I was admitted in your hospital. So the possible causes like in some people they are not taking the proper diet. Okay, if some people if the people are taking the balanced diet is unlikely to have this type of low blood count. Some people they are losing the blood in their from their gut in their stool. Sometimes they have got like black stools and they do not notice it. Some people they have got dark color water work. So these are the things that you have to highlight, and he will give you yes doctor, I am having this problem. And if you feel like some question you can ask in the communication also. Okay, then Dr. Anis, is there a not a waiting period before colonoscopy after MI? Yeah, there is a waiting period, and likely this scenario they mentioned you that the patient was admitted 1 month ago. 1 month ago is the waiting period, but again, the risk and benefits is the main important thing that we have to see, and it will be decided by the multidisciplinary team. Okay, then Dr. Pooja, for this time, we will continue both these don't are anticoagulant. These are the antiplatelet agent. Warfarin, DOACs are the anticoagulants. So these are the antiplatelet agents. So they are less aggressive as compared to the anticoagulants. I hope these are the answers. If you have any other questions, you can ask directly. You can open your mouth, the mic, and you can ask directly. Welcome, Dr. Jim. Dr. Jim John and Dr. Manish, thank you very much for doing the scenario today. So if you people have any question, you can ask. If no question, we will end the meeting now. Okay, thank you again for joining. Good night.